Pharyngitis, which is another condition of the upper respiratory tract, inflammation of the pharynx, can also be acute or chronic. When it's acute, sudden painful inflammation of the pharynx. When it's chronic, that is persistent inflammation of the pharynx. That means its symptoms can last for prolonged period of time. And mostly pharyngitis can also be of different types. We have viral pharyngitis, which is the most common type of pharyngitis, which can be caused by adenovirus or influenza virus or rhinovirus. But we also have bacterial pharyngitis, and we also have fungal pharyngitis. Mostly now could be it comes on as a result of environmental exposure, more especially when one is exposed, because viral pharyngitis is the most common when one is exposed to viral agents, and also in poor ventilated rooms, because now with poor ventilation, it means now that those viral agents get to circulate just within that room, and one is able to contract that. The etiology, I've just talked about it, the viral pharyngitis, but again, we've talked about bacterial pharyngitis and also fungal pharyngitis. So what happens with pharyngitis? With one's exposure to the viral cause or viral agent of bacterial agent or the fungal agent, there'll be an immune response. Go back to your pathophysiology or your pathology, there'll be an immune response where the body is trying to respond, and it's going to trigger inflammatory reaction within the pharynx. And that inflammatory reaction, of course, going to present with the various symptoms of inflammation, the pain, the fever. There'll be vasodilation because the white blood cells are trying to respond to that inflammatory reaction, which will bring about the edema and, of course, tissue damage along the areas that has been affected, which will be presented by redness and also swelling of the tonsillar pillar, the uvula, and also the soft palate. So to diagnose that, again, pharyngitis just needs you to do history taking, physical examination where you examine the throat, observe its appearance, where there are white-like patches that are appearing, redness, swelling, and also look at the swollen lymph nodes. If you want to determine the causative agent, then you can do a throat swab, which is going to help you to know the exact causative agent, so that it's going to help you to know the way you are going to manage that. Symptomatically, pharyngitis presents still with sneezing, with a runny nose, with headache, with fever, swollen lymph nodes, patient having difficulties in swallowing, a red throat that has white patches that we have talked about, which again on your physical examination, you can evaluate that. So if you look at these upper respiratory tract infections that we have discussed thus far, go to rhinitis, go to sinusitis, we are now on pharyngitis. If you look at them and the symptoms, they are more or less the same. If sneezing, it will appear in all of them. Runny nose, it's appearing. Cough is appearing. So that's why once you get to have an understanding of one, then you just get to manage the rest. So to manage pharyngitis, again, it's important you get to know if the causative bacterial, then you just manage with antimicrobial agents, the erythromycin, the penicillin. If it's viral, you get to manage with antiviral drugs. If it's bacteria, fungal, you get to manage with antifungal drugs. Your nursing management, again, your nursing management will be based on the symptomatic presentation of the patient. Look at the patient, how is the patient presenting? And that's how you get to manage your patient. There is what we call the supportive and pharmacological management, like encouraging rest, increased fluid intake. Let me tell you, one of the things upper respiratory tract infections, Your nursing management that cuts across encourage rates for your patients. Increased fluid intake, it applies for all of them. Why? You want to liquidify those secretions so that they can be expectorated. So that applies for all of them. Then avoiding smoking and alcohol, still it applies for all the upper respiratory tract infections. Humidifying the room to reduce throat dryness or the airway dryness, it applies for all of them. Encouraging good oral hygiene, it applies for all these upper respiratory tract infections. Um, then, of course, educating the patient. You can also prepare the patient presenting the strep throat and history of rheumatic fever, where now you just have to focus on initiating and administering the antibiotic therapy. In MedSearch 2, we'll be talking about cardiovascular diseases, and one of the diseases we're going to discuss about is rheumatic heart disease. Rheumatic heart disease, usually one of the causes is patients who have upper respiratory tract infections. Uncontrolled and managed upper respiratory tract infections which present with rheumatic fever, which now is going to eventually affect the heart. So to manage that and to prevent the complications of developing rheumatic heart fever, initiate the antibiotics, administer them, and make sure that there is compliance. To relieve pain, warm saline gargles that are going to relieve pain. That applies for all of them. Complications of the pharyngitis, rheumatic fever, which I've talked about it, which again can eventually lead to development of rheumatic heart disease. Glomerulonephritis, which again can be a complication of pharyngitis. So it's important that you get to manage the patient and make sure that you control the pharyngitis at the earliest onset possible. And they are very possible the URTIs are the easiest of the conditions to manage in a patient.